So moving on to actually discuss another clinical sign. Now this is what is known as what? The cervix motion tenderness, if you want to elicit it, or you call it the chandelier sign, right? Cervix motion tenderness, chandelier sign. Now I want you to actually take a view of this picture very well. You look at how he actually place his hand to actually look at the cervix. Now, to feel the cervix rather, all right? So you are feeling it. This is because you want to look how the patient will react to it. I want to also feel it, right? What you actually feel when your hand is actually touching the cervix. This will help you to diagnose a lot of disease conditions, right, that could actually occur to the cervix. So cervix motion tenderness, right, you should actually take note that this is also known as what? The chandelier sign. It's a clinical finding during gynecological pelvic examination. So I've already taken medical history, I've already spoken with the woman, so I'm suspecting that there's an issue, the cervix and all of that, So what is it? It refers to what? Pain elicited. So when you move the cervix, you are looking at the patient as you are doing it. So some patients might not actually react loud, some is just some facial expressions. It shows that she's feeling pain, right? So the term chandelier comes from the intense pain some patients feel, so severe they may reflexly reach upward as if they want to grab a chandelier. Do you understand? So that's why they call the chandelier sign, all right? So it helps to dictate all these inflammatory conditions of the cervix. So what conditions can cause it? That means if you elicit pain, you can be suspecting that some things are on ground, right? So pelvic inflammatory disease, ectopic pregnancy, peritoneal irritation, right? Maybe there's an inflammation on the lining of the abdominal cavity, all of these issues. So symptoms that may accompany it: you might have lower abdominal or pelvic pain, you might have fever, you might have abnormal vaginal discharge, you might have pain during intercourse. So all these ones are actually trying to ask the person in medical history, right? So one thing leads to one thing. You don't only do one, you're asking questions. Then also ask the person, all right, how have their menstruation been and all of that. So these are the possible answers you should get, right? Do you have any whitey stuff from your vagina or any color stuff? They tell you that there's a discharge, right? When you have sex, you have pain. They tell you that that's what dyspareunia. Okay, so this is just an image showing the different conditions that might actually make the cervix of a woman pain her. Not really the cervix directly, but when you move the cervix, you should feel pain. Do you understand? Ectopic pregnancy, uterine fibroids, ovarian cyst, endometriosis, ovarian torsion, pelvic inflammatory disease. All right. So diagnosis, you do further things. You still do pelvic examination, all right? You do ultrasound. You cannot do imaging to look at the internal environment, what's wrong. You do lab tests. This is where you want to now test if there's any sexually transmitted infection, okay? So treatments, if it is bacterial, use antibiotics. If it is any ectopic pregnancy or abscess, surgeries might actually need to come in. And pain management, that's when you use non-steroidal anti-inflammatory drugs, then other pain relieving agents. Okay, so that's it for this cervix motion tenderness.